Hi, everyone. Welcome to the 21st Lupus Summit hosted by the Lupus Foundation of North Carolina. Thank you so much for choosing to attend this session, Practical Applications for Managing Acute Autoimmune Flare-Ups. My name is Daniela Spear, autoimmune movement coach and health coach, and I'm so glad that you've chosen again to join me for this session. I will be providing you all with a couple of very practical things that you can implement starting right away. They're very easy to implement for whenever you are experiencing an acute autoimmune flare up. And even if you're not experiencing an autoimmune flare up at the moment, these are all very healthy habits that you can implement to even prevent flare ups in the future. So I will be providing you all of this information through the presentation, and then at the end of the presentation, I will also be providing a way for you to stay connected with me, get in touch with me if you have any questions or would like to discuss anything further that was in the presentation. So let's get started. I'm going to share my screen and I will share the presentation with you all. Okay, so again, welcome to Practical Applications for Managing Acute Autoimmune Flare-Ups. Again, I'm Daniela Spear, autoimmune movement coach and health coach for Remade Wellness. A little bit about me. Okay, here we go. A little bit about me. I'm also a lupus thriver. I've been a lupus thriver since 2008, so 13 years. I have a background in exercise and sports science from the University of North Carolina at Chapel Hill. I started my career in fitness really, I think, from when I was a child. I was always really active in sports growing up, but officially started my career in fitness in 2013 as a group exercise instructor, and then I became a certified personal trainer. And after that, got certified as a health coach and became a business owner in 2016. Since then, I've also worked as a wellness coordinator for Exos and have been certified as a strength and conditioning specialist. And most recently, I have launched full time into Remade Wellness as an autoimmune movement coach. So that is what I am doing now. I'm really passionate about helping other autoimmune warriors reduce flare ups through movement, through breath work, through simple nutrition strategies. My mission is really to help you move well so that you can feel well and live well. Because when we feel well and when we are living well, we're able to love others and the world around us well. Other things about me, I'm a plant mom. You can see my fiddle leaf tree behind me here, and I have a variety of other plants as well. I'm a dog mom to a 4-year-old boxer. I also enjoy blogging and writing. That's one of my other passions, and traveling with my husband. And then also, I really love M&Ms. I love chocolate. So don't let the health coach title fool you. I am a sucker for chocolate. All right, so in this presentation, we are going to cover, here we go. Okay, in this presentation, we're going to cover a variety of topics. But before we do that, I do want to just make sure that everyone understands that I am a nationally certified personal trainer and health coach. I am not a medical doctor. The information that I'm sharing in this presentation is meant to simply educate. It is not intended to treat or diagnose any illness or disease or condition. Like I said, it's provided to to educate you, increase your knowledge and awareness around tools that you can use to implement in your own life for overall well-being. And these are all things that I have learned through my own education, through my own research, and through my own experience, applying these to myself and to my clients as well. So just remember, I am not a medical professional, but I am a health coach. Okay, so topics for our presentation today. We're going to cover what are autoimmune flare-ups, then the difference between acute and chronic, and then I'm also going to talk about the lymphatic system and its role in the immune system. We're going to cover some breathing techniques, what is structured water and why is it important, and we are going to end our session with a little intentional movement session. So for that piece, it'll be the last part of this presentation. You will need a chair and a stick of some sort, maybe like a broom or like a mop, or if you have like some kind of dowel or like a baseball bat or something, any kind of stick will be just fine. And if you don't have a stick, don't stress about it. You can still participate. Okay, so let's talk about autoimmune flare-ups. Okay, what are autoimmune flare-ups? So if you're a lupus patient or a lupus caregiver, which I'm assuming most of you are if you are attending the Lupus Summit, you all know how devastating the impact of an autoimmune flare-up can be just on your mental, physical, and spiritual health, right? A flare-up is an increase in autoimmune activity and symptoms, and you typically don't feel that great. And they can range from very mild to very severe. So today we're going to talk about the difference between acute and chronic. So an acute flare-up is one that has a very sudden onset. It you experience a worsening of autoimmune symptoms, and it can last a couple days, anywhere from like 1 to 5, 6, 7 days up to a week, and then you usually start to feel better, right? So it's this sudden onset. It's very short-lived, and then you start to feel better. And then a chronic autoimmune flare-up has a more gradual onset, and it's a worsening of autoimmune activity. And this one can last several days to months, even to a year. And that's why it would be identified as chronic, because you typically experience this flare-up for a longer amount of time, and typically it requires some kind of medical intervention, whereas an acute flare-up you might be able to just kind of deal with at home. For today's presentation, practical applications for managing an acute flare-up, we are going to be really focusing on the acute flare-ups that you typically, experience over the course of a few days. We've all experienced them, like we, wake up one day and you suddenly feel like you've been hit by a truck, but you have no idea why, right? That is just the nature of autoimmune activity. It is very unpredictable, and sometimes you just wake up with a flare and you just feel like very tired, fatigued, lethargic. You experience brain fog. All of those things would be categorized under that acute flare-up. Okay, so why do we even experience flare-ups in the first place? So there are a lot of contributing factors when it comes to experiencing autoimmune flare-ups or autoimmune symptom flare-ups, right? And there's not necessarily ever like just one thing. It's usually a variety of factors playing together. But one of the most common, in fact, it is like the most common contributor to autoimmune flare-ups is stress, right? So autoimmune flare-ups are really the body's response to stress, and stress is the body's reaction to any change that requires an adjustment or a response. So this stress can be external, either from your environment, from work, from relationships, whatever's going on outside of you can be a stressor, but also things happening inside of you. For example, maybe you ate a food that was inflammatory for your body, and that can trigger a flare up as well. So any adjustment, any change that requires an adjustment or a response from your body would be considered stress. Now, there are good stresses and there are bad stresses, but too much of either of those is going to elicit a stress response from your body. Okay. And it is important to become aware of that, to become aware that stress triggers autoimmune flare ups, because when you become aware of the stressors in your life, or the fact that even stress is contributing to an autoimmune flare up, you then have a choice. When you become aware, you then have a choice to respond differently. Because if you are in this flare up and you have absolutely no idea what is contributing to it, then you can't make a change. But if you become aware of a variety of stressors coming at you, you're going to be a lot more prepared to respond in a very appropriate way that's going to address that stressor. So let's talk a little bit more about stress and its effect on the body. So when you are stressed, your body releases cortisol, adrenaline, norepinephrine, and all of these hormones are our stress hormones, and they are very useful in terms of getting us out of potentially dangerous situations, right? And although today we experience stressors very differently than our ancestors did, our brain still responds to any stressor in the exact same way. So whether you are out hunting some wild animal to bring home for dinner, or you are feeling pressed to meet a deadline at work, your brain and your body are going to respond the exact same way to both of those stressors. Okay, so it's great for survival, not so great for recovery, right? In our society today, while we don't experience as like big and dramatic stressors like some wild tiger coming after us, right? We do experience a lot more of little stressors that add up even more. So things like, sitting in traffic and feeling frustrated, getting to work and dealing with a boss, having to pay your health insurance, or having your drawer full of medical bills that need to be paid, but then you have to also take your daughter to soccer practice, and this, and that. You have all of these little stressors that add up to this much bigger effect. So whereas our more primal ancestors maybe went and hunted their food, and they came home and they had food for several days, so they kind of their body kind of came down from that stress response. Whereas today we are a lot more on the go, so our body isn't as able to come out of that flight or fight response. So when we are stressed, we are operating out of our sympathetic nervous system, and that is that flight or fight response. And when that sympathetic nervous system turns on and stays on, then the parasympathetic, which is our rest and digest, is not able to do its job and help our body come down from the stress. So our feel-good hormones like our serotonin, human growth hormone, oxytocin, dopamine, those endorphins, they're not able to do their job because cortisol, adrenaline, norepinephrine are just on all the time. So that is why it is important to learn how to address our stress so that we can give our body time to come down from that parasympathetic state. And we're going to talk about some ways to do that today. So one of the ways to address stress is to develop a relationship with yourself. And I know that can sound a little weird. You're like, what do you mean? Relationships are about other people, right? Yes, but having a relationship with yourself is just as important. In fact, I believe that it is the most important relationship that you will ever have, is a relationship with yourself. So we as a people have become so disconnected from ourselves that we don't really even recognize who we are anymore. And we spent a lot of our lives very disconnected and distracted by our phones, the TV, social gatherings, things like that. None of those things are bad. We just have are overstimulated. We live in a very overstimulated society, so it's hard for us to even spend time with ourselves. And I want you to think back to when you were a child, when you were a kid, right? You didn't really have a hard time entertaining yourself, right? It was somewhat easy to play with yourself, and if none of the other kids wanted to play with you, you kind of just made up your own game, right? And somehow, through school, extracurriculars, work, other relationships, we have lost that ability to interact with ourselves because we're interacting with our phone, we're interacting with people. And even if there is downtime, a lot of us feel very like anxious, very nervous to sit still, right? So sometimes I hear things like, well, meditation doesn't work for me. I can't turn my brain off. It's, things like that, we feel that it is difficult to sit and be with ourselves because we're so overly stimulated by outside factors. But I believe that one of the most profound things that you can do for your health is develop this relationship with yourself. And if you are asking, where do you start? Start with spending time alone with yourself. And I know that sounds really scary, and it might feel that way at first, but once you put that into practice, it does get easier. And this does require you slowing down enough for you to create that time to have with yourself. And for those of you that maybe aren't working right now or spend a lot of time at home already, and you think like, well, I'm already doing that, I just want to remind you that watching TV or scrolling on your phone, or sitting there thinking about all of the stressors or trauma that you might have in your life, that is not necessarily alone time with yourself. You are distracting yourself by other means. And so I would challenge you to create some very intentional time that is just you, no TV, no phone, no distractions, and just be with yourself. And whatever comes up for you, because I know that for most people, very uncomfortable thoughts are going to come up. Maybe some negative self-talk, maybe some bad memories, things that have frustrated you. I will encourage you to lean into those moments, into those thoughts, those feelings, those emotions that come up without judgment. So allow yourself to experience any and all of those emotions that come up, and simply allow yourself to experience them without saying, no, I can't be angry about this, or I shouldn't be angry, I shouldn't be upset about this. There's no should or shouldn't here. You're just allowing yourself to experience the emotions that you as a person have, because all of those things play together into who you are as a person and to maybe why you're experiencing autoimmune symptoms, right? So it is a little uncomfortable at first, but the more that you practice just being with yourself, the more comfortable it gets. And I think that you will be very surprised at how much you discover about yourself while you work on developing a better relationship with yourself. So something to try. I think that this is a very useful tool in managing stress and assessing the stressors that you have in your day-to-day life. I need to plug in my computer. There we go. Okay. So I'm going to take a quick sip of water, and if anyone has water with them, I encourage you to do that as well. Okay. So we are going to dive into the lymphatic system. And the lymphatic system, I'm talking about this one first because it is the system that most often gets forgotten when we are in school. Even if I think back to like my anatomy classes in college, we didn't really spend a lot of time in the lymphatic system. But in my own studies and research, I have come to understand the great value of the lymphatic system and the significant role that it plays in the immune system. So, the lymphatic system is Latin for clear water. Lymphatic, lympha is Latin for clear water. And I want you to think of this lymphatic system as more like a filtration system for your body. Okay. Now I want you to imagine, I want you to picture like a fish tank, right? This is a really good analogy, I think, to help explain the role of the lymphatic system. So I want you to picture a fish tank, very clear water. If anyone has seen Finding Nemo, you remember the fish tank in the dentist's office when Nemo gets in there. It's very clean. All the fish are happy. You can see the plants in there. All the fish are swimming. They're happy, right? But then they like devised this plan to clog up the filter so that the fish tank will get dirty, and then the dentist will have to take the fish out of there, and then Nemo can escape. But okay, so we first see the fish tank very clean and clear. The water is very clear, you can see it. But then over time, after they have clogged the filter, what happens to the water? It starts to get dirty. It starts to become like green. There's like brown algae and stuff like growing on all the things in the fish tank, and it just doesn't look very appetizing, right? You wouldn't want to be swimming around in there. Like fish are literally swimming around in their waste, and that is what the lymphatic system does. It is the body's filtration system. It is responsible for clearing out bacteria, viruses, fungi, cellular waste, cells that have died, any proteins or other toxins, right? And when it gets clogged, when that lymphatic system, when the lymphatic fluid is not moving, it gets backed up and your body hangs on to those toxins, bacteria, cellular waste, things like that. And so you have over 700 lymph nodes in the body, give or take a couple hundred, depending on the size of your body, and around 15 liters of lymph fluid that flow through your entire body. And I want you to think about that in comparison to how much blood you have. You carry about 5 liters, again, give or take, depending on your size, 5 liters of blood, whereas you carry 3 times that amount in lymph fluid. So you can see just how important it is. And now when it comes to your immune system and the relationship between the lymphatic system and your immune system, your lymphocytes are kind of the main warriors of your immune system. Those B and T cells in the nodes and those node clusters are what are responsible for getting rid of anything that should not be in your body. So if you look at this picture here, you can see kind of the green, all the green lines through the body. And then if you look like near the neck, the shoulders, the hips and knees, you can really see those, the little nodes there. So those are your lymphatic nodes. And the lymphatic system runs alongside the circulatory system and along your nervous system. So it's like kind of all these, imagine just wires, so to speak, running through the body. But what is different about the lymphatic system is that unlike the circulatory system that has a heart to pump blood all the way through the body, the lymphatic system does not have a pump. It does not have a motor. It relies strictly on 2 things that move lymph. It relies on movement and on breathing. So moving and breathing are crucial for moving that lymphatic fluid through the body. But even sometimes when the lymphatic gets so backed up and it's stuck, it requires some manual pressure to keep that lymph from becoming stagnant. So it keeps it moving, right? So it'll require a little manual pressure, which I'm going to show you today how to do that. So I really like this quote. The body cannot get well in the same environment it became ill within. Okay. Now, illness is a wide spectrum, but we are all here because we are dealing with a chronic illness, lupus, hyperactivity of the immune system. Our immune system is not acting right, so we are here because there's something else going on in the body that has disrupted the normal activity of the immune system. And any illness, the majority of illnesses are mainly due to the stagnation of fluids. So that is when that lymphatic system becomes stagnant, it's not moving, and it cannot clear waste from the body, and it cannot get good nutrients to new cells and things like that. So that is where illness or dis-ease happens, right? We experience discomfort, we experience pain, we get a diagnosis of another disease or something like that. But if we can stimulate blood flow, if we can stimulate lymph flow, the body is able to recover. So if you are experiencing a chronic illness, that is more likely, it is more likely that you are experiencing a lymphatic problem. And a few indicators that you are experiencing a lymphatic problem are chronic pain, chronic fatigue, poor sleep, an inability to lose weight, brain fog. So when you have trouble concentrating, right? Adrenal exhaustion, just when you are just so burnt out from everyone and anything. Slow recovery, easy bruising, delayed onset allergies, red eyes or gray eyes. So all of those are all indicators that there's something not well with the lymphatic system. So when the lymphatic system is not efficient, the body then starts to rely on other vital organs. So think like your kidneys, your liver, your lungs, your skin, and even your body's fat. It starts to rely on those organs to clear off the toxins. And this can increase failure in each of those organs because they have become overburdened. And so when the body is overburdened by toxins, it starts to lay down more fat because it pushes those toxins out into your fat cells to get the toxins away from the vital organs. So laying down more fat cells is going to result in weight gain, but oftentimes that weight gain is actually a very protective mechanism that your body is using to protect your organs, because when your whole system is overburdened by toxins, it pushes out the toxins into fat cells where it is stored. And sometimes your brain and your body do not allow you to lose weight, because if you were to start to reduce those fat cells, your body would release those toxins into your body. And if your lymphatic system is not working well, your body would not have a way to eliminate the toxins that are in your body. So this is why it's really important to first get the lymphatic system working again, get that lymph fluid moving, which will then allow you to lose weight and get the toxins out of your body, so your body doesn't have to store them in fat. That is also a conversation around weight loss as well. But today I'm going to show you all a self-lymphatic drainage technique that you can do at home. It is safe to do every single day. It's called the Big Six. And then we are also going to focus on the head and neck, draining of the head and neck. And I'll explain a little bit more about that as well. So go over to the next slide. So the big six, I'm going to show you exactly where these areas are on the body. But first, I want to just make you aware that as we can stimulate this lymphatic fluid, if you have been experiencing stagnant lymphatic fluid, you might experience a slight headache, a little bit of dizziness, nausea. Kind of feels like maybe you have a hangover because your body is releasing and moving those toxins. So you might feel a little bit worse before you get better. If that is the case, if after we go through these today, you are not feeling very great, you feel maybe like you have a little bit of a hangover, I would wait a day or two until you are feeling better before doing these again. But otherwise, the big six, this technique I'm going to show you is perfectly safe to do on a daily basis. In fact, I encourage you to do it on a daily basis as long as you are feeling well. But some of you might even experience like a rush of energy, like a sense of lightness, and you're going to feel really great right away. So it kind of just depends on where you are. Now, if you are experiencing an acute flare-up right now, I will ask you to hold off on doing the big six and then participate when we do the head and neck lymphatics first. So if you are currently in a flare-up, I will ask you to simply just watch for now and then participate when we do the head and neck in a few minutes. But other contraindications I want to make you all aware of is if you have a localized infection or acute inflammation caused by bacteria or viruses, currently experiencing a fever of over 102, any thrombosis, blood clots, congestive heart failure that is not being treated, any renal failure, or malignant cancer, you're going through chemo or radiation, we'll ask you to not participate in this part of the presentation. Okay. So I'm going to ask you all to stand up with me, and we are going to go through a self-lymphatic drainage technique that is going to help you keep your lymphatic system very happy and healthy and keep that lymph fluid moving through your body as it should. So we're going to stand up. I'm going to move my chair to the side here. Okay, so hopefully y'all can see me here. Actually, I'm going to stop sharing my screen for a moment. That way you can all see me. Hello. And we're going to go through our big six, okay? So the way that lymphatic fluid flows, it's always towards the heart, right? So all of your lymphatic fluid kind of flows in this big loop, and it's always draining towards the heart. So it's really important that we first open up the lymphatic nodes, lymphatic pathways that are closest to the heart so that everything else can flow up, okay? So we are going to do a combination of rubbing and tapping on our skin, and we're going to do these in sets of 10. Now I have to get the questions. Well, can I just do 5 or can I do 15 or 20? And the answer is yes. Okay, so the reps don't necessarily matter. You can do as many as you want. But what is really important is the order in which we do these. And so I'll walk you through the 6 main areas of the body. And it's really, really important that you follow this specific order, okay? So our first point is going to be our collarbone. So if you find your collarbone, it's a very bony area, kind of the bottom of your neck here. And I want you to place one hand on top. So the hand is going to be above and below that collarbone. And then I want you to rub 10 times. And I want you to press and rub just hard enough so that you can feel the skin move. But I don't necessarily want you to hurt yourself. You're going to rub 10 times, and then you're going to tap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? We're going to go to the other side. So same thing. You're going to place that hand above and below the collarbone, and we're gonna rub 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and tap 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, so that's our first area. That's our first lymphatic pathway that we open up. Our second is going to be behind the ear on the upper neck. So I want you to take 2 fingers and I want you to just feel behind the ear. You're going to feel like a little divot there, right? Yeah, so you're going to place your hand on, starting at that little divot, then place your hand down on the side of your neck. You know, if you can kind of almost see this muscle here, you can feel it. So you're going to rub there, and we're going to do 10. 5, 6, 7, 8, 9, 10. And again, you're going to tap. All right, and then we're going to do the same thing on the other side. We're going to do rub 10 times. 1, 2, 6, 7, 8, 10. And then you're going to tap. So we've got collarbone 1, upper neck 2, number 3 is your pec and your axillary, your armpit area. So here, you can go above or under the shirt, doesn't matter. You're gonna rub 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and you're gonna tap. And then go to the other side. So again, we're gonna rub 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and you're gonna tap 1, 2, 3, 6, 7, 8, 9, 10. Okay, so those are 3 points. We are halfway done. Collarbone is 1, upper neck is 2, pec and armpit area is number 3. Now number 4, you're gonna find your belly button, and you're gonna place one hand on your belly button, and you're gonna place your other hand on top. And you're just gonna rub, and you can rub up and down, side to side, rub 10 times, and then you're gonna tap. 6, 7, 8, 9, 10. Okay? And number 5 is your inguinal area. So if you were to pick up one leg, wherever your hip crease is, that is your inguinal area. So you're just going to rub. So press down and rub. And 10, and then you're gonna tap. All right, so we've got 5 so far: collarbone, upper neck, pec area, our abdominal area, and then our inguinal area is 5, and then the last one is behind the knee. So you're gonna take your hand behind your knee, and you're gonna rub up and down. 6, 7, 8, 9, 10, and you're gonna tap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then on the other side, you are going to rub and then tap. All right, and so that is your big 6. So if you were to wake up one day with an acute flare-up, you suddenly wake up, you're not feeling that great, the first thing you're gonna do is do your big 6 lymphatics, okay? This is going to help to stimulate lymphatic fluid to clear out whatever inflammation is happening in the body that shouldn't be there, okay? And it's gonna help clear your mind, clear brain fog, especially the head and neck lymphatics we're gonna do next. But the first thing you want to do is your big 6, okay? So if you wake up and suddenly you're not feeling so great, do your lymphatics first, okay? So that's going to be first. Okay, so the next part of this presentation, we are going to focus on the head and neck. And I'm just going to sit here so that you can all see this up close. And we have 7 areas on the head and neck. Now the head and neck, you want to do this one about 1 to 2 times a week, or if you're experiencing a headache or a migraine, or again, if you wake up with an acute flare-up, you have a lot of brain fog, a lot of trouble focusing, or you feel like your brain is on fire, due to brain inflammation. Do the head and neck lymphatics first, and then do your big 6 second. Okay, so your head and neck is going to start above that collarbone, and it's going to be the exact same approach. A little bit of rubbing, a little bit of tapping. Now the pressure, the speed, all of that is at your discretion, but you want to do it enough so that you move that skin. So I'm going to start just above my collarbone, and I'm going to rub, and then I'm going to tap. And you can also use your whole hand on here. Typically in this area, I'll use fingers because my hands are like bigger than my face. And I'll do the other side. And then I'll tap. All right, so that first area is above the collarbone. The second area is, again, the upper neck. So it's going to be the same as the big 6. And then on the other side, same thing, we're going to rub. And then tap. Okay, so 1, above the collarbone, 2, upper neck, 3 is going to be under your jawbone. So if you've ever had a sore throat or a cold, you can sometimes feel those like lymph nodes swollen through there. So what I'm going to do is just kind of like rub through here. And then I'm going to tap. This is where using your fingers comes in a little more handy. All right, and then 4 is going to be just under your cheekbones. So you're going to find your cheekbones, they're kind of just like located beside your ear, kind of coming in towards your face. So if you find your cheekbone, you're going to go just down, and you're going to feel that little divot, and through there, I'm just going to rub. And you might feel, if you tend to hold tension in your jaw, this area will feel pretty tender. And then I'm going to tap. All right, and so that's number 4. So 1, collarbone, 2, the upper neck, 3, underneath the jaw, 4, under the collarbone. Number 5 is going to be your smile line. So if you smile, you'll find those little lines. So through here, this is going to look a little funny. You're going to rub. You can even like pinch. Please no one take a screenshot of this. But you can kind of pinch and massage through there, and then again tap. Tap through there. All right, number 6 is going to be your temples. So some of you might be familiar with this area. If you tend to get a lot of headaches, you might find yourself rubbing through here. So what happens is if you rub through here first and all of the other drainage points are blocked, it's not going to do anything for you, which is why you have to open up the other drainage points first, so that whatever is causing tension up here has a pathway to flow out. So this is why, again, the order is really important. And we'll tap. And then last but not least is going to be behind the head, the suboccipital, which is going to be at the base of your neck. So if you kind of find where your skull meets your neck, you'll find a little divot through here. And you're just going to, again, kind of use your fingers to rub through there. And you're going to tap. All right. And that is your 7 points. So we'll go through those one more time. Above the collarbone, 1. Behind the ear, 2. Under the jaw, 3. Cheekbones, 4. Smile lines, 5. Temples, 6. And then base of the neck here 7. So that is for your head and neck, specifically head and neck lymphatics, okay? All right, so again, the next time that you wake up with a flare and you want to just provide enough relief so you kind of figure out what you need to do next, do the head and neck first, and then do the big 6 that we went over before. The big 6 is, like I said, perfectly safe and encouraged for you to do on a daily basis. I do it as part of my morning routine. After I wake up, go to the bathroom, brush my teeth, I run through the big 6. It takes like a minute. And it's just such a very simple tool to promote health and well-being on a daily basis. So I encourage you all to try that and let me know what changes you experience. All right, so I'm going to go back to our presentation here. And so we're seeing again the big 6, the list of the 6. And then here is that the head and neck lymphatics, the above the collarbone, the upper neck, under the jaw, the cheekbones, smile lines, your temples, and then the back of the head. So those are your 7 areas for head and neck lymphatics. Okay, so the next topic that I want to talk about is breathing. I mentioned earlier that 2 ways to move the lymph is through movement. So we just did some manual movement to our lymph. The second way to move lymph is through your breath, okay? And I want you to think about the fact that you breathe over 200,000 times a day. Like, that is a lot of breathing, and most of us are doing it wrong. So I want you to do something for me. I want you to sit up in your chair, place both feet on the floor, and I want you to just take a deep breath and out. And what did you notice? Did you notice your shoulders rise? Did you breathe in like this? Or did you breathe in, out? Did you see like feel like your belly moved out? Now, if you notice your shoulders rise, that means you're an apical breather. You breathe through your chest. If you notice your belly rise, that means you are a diaphragmatic breather. You breathe through your diaphragm. Now, ideally, we would all be professional diaphragmatic breathers. Breathing through your diaphragm allows for more deeper breath, which is going to get more oxygen into your body. But due to stress and anxiety, a lot of things, distractions, we start to over time breathe through our chest. If you ever watch a baby breathe, you'll notice that they breathe more through their belly, and their rib cage kind of expands a little bit more. That is ideally what we want to aim for. So I'm going to show you some breathing techniques. So again, I will stop sharing here so you can all see me. So the reason why breathing is so helpful with lymph fluid is because your diaphragm, that kind of sits right underneath your rib cage, also in that kind of intersection, your cistern chyli, which is your biggest lymph node in your entire body, sits through here. So breathing through that diaphragm, stimulating movement in that diaphragm, is going to help stimulate the lymphatic system as well. And not to mention that getting more oxygen to your cells is going to help your body heal and recover from whatever it is experiencing. So what I want you to do is I want you to take your hands and place them on your rib cage. And when you breathe, I want you to breathe into your rib cage. So I want you to imagine your rib cage expanding in all directions, to the front, to the side, to the back, a very 360 motion. We typically see people breathing through their chest, up, versus breathing out. Okay, so once you place those hands on your rib cage, I want you to just take a couple breaths and think about pressing out against your hands with your rib cage. Notice how my hand's gonna move outward. And one more deep breath in and out. Okay, so during moments of stress, during times of acute flare-ups, I want you to, one, do those lymphatics, and then two, come back to the breath and really focus on paying attention to the breath, okay? Two breathing techniques that I really like to use. In fact, one of them really helped me fall asleep last night. I was having trouble sleeping, and I started practicing resonance breathing, and I fell asleep. Resonance breathing is just a pattern of breathing in and out for the same length of time over 2, 3, 4 minutes, however long you decide. In my case last night, I just sort of fell asleep, so I don't know really how long I did it for. But I want to practice breathing in for 5 and out for 5, and we're going to do a few rounds. And you can go ahead and place those hands on your rib cage again. So we're going to breathe in. Here we go. Breathe in 5, 4, 3, 2, 1, and exhale 5, 4, 3, 2, 1, and again breathe in 5, 4, 3, 2, 1, and exhale 5, 4, 3, 2, 1. Again, breathe in 5, 4, 3, 2, 1, and exhale 5, 4, 3, 2, 1. And you're just gonna repeat that cycle as many times as you need to help you connect with your body enough for you to be able to ask, what do I need today? What do I need to take care of my body? Sometimes when we wake up with a flare-up, it just makes us even more anxious because we have to call into work or we need to cancel things, and that can worsen the flare-up. So taking a moment to breathe, push that lymphatic fluid, get connected with our body, and slow our mind down is going to be really helpful. Okay, so the next technique that I want to share with you is box breathing. So box breathing is a method of breathing in, holding your breath slightly, breathing out, and then holding that breath at the bottom again. So the only contraindication is if you are currently pregnant or you are currently experiencing frequent seizures, I will ask that you just simply watch and do not participate in box breathing for the time being. Okay, so we're going to breathe in for 4 seconds, hold for 4, exhale for 4, and then hold for 4. And we're going to do a couple rounds of that. So you can let those hands rest by your side. You can place one hand on your belly, one on your chest. You can place them on your rib cage, whichever is up to you. So we are going to take a deep breath in. Think about expanding that rib cage, breathing in through the nose. 4, 3, 2, 1. Hold at the top. Relax the shoulders. And exhale, 4, 3, 2, 1, and hold. 4, 3, 2, 1, and breathe in. 4, 3, 2, 1, and hold. 4, 3, 2, 1, and exhale. 4, 3, 2, 1, and hold. 4, 3, 2, 1, and breathe in. And you can repeat that cycle, that 4, 4, 4, 4, for as many rounds as you would like. Sometimes I practice this in the line at the grocery store. Sometimes I practice it in the evening before falling asleep, or just in the middle of the day if I feel like I am not focusing well. I like to practice that box breathing. So either that resonance breathing or the box breathing are really great tools for when you wake up and you're experiencing an acute flare-up of symptoms. It's going to help kind of tell the body like, hey, we are safe. We can relax and heal and recover. Okay. All right. So we have talked about lymphatic drainage. We have talked about breathing as a way to help the body recover from acute flare-ups. And next, we are going to talk about hydration. So let me share my screen again. Okay. Whoops. Okay. So we went over the 360 breathing, resonance breathing, and box breathing. And next we are going to talk about hydration. So when it comes to hydration, it's not about how many ounces of water you drink. It's about how much your body actually absorbs. Okay, so now's a really good time to take a sip of water if you have water close by. So I often see, especially in the fitness field, I often see people guzzling down a gallon of water a day. And while the intention is very admirable, I have to wonder, is their body truly absorbing all of that water? A lot of times, when, we've all experienced this, like when we have chugged water, we then 20, 15, 20, 30 minutes later, we are running to the bathroom and we're just peeing out clear water, right? And oftentimes that water is taking with it electrolytes, vitamins, and minerals that your body needs. So over drinking water, plain water, can actually have the reverse effect, which is why it's important, one, to drink an appropriate amount of water for your body size, but two, also discuss structured water. Structured water is a recipe, and you can also find structured water in fruits and vegetables. I'll explain that a little bit more. First, I want to talk to you about what does dehydration look like, because a lot of us don't even know that we are dehydrated. It looks like fatigue, hunger, brain fog, headaches, joint pain, stiffness, trouble sleeping, bloating, moodiness. What does that sound like? A flare up, right? Very, very similar. So, I'm not saying that for any of you experiencing a current lupus flare up, I'm not saying that, that you're not, but I'm just asking you to consider that dehydration looks very, very similar to a flare up. So, can you really rule that out? So we are often very quick to blame lupus, and we wake up feeling terrible and we're like, oh, it's a flare up. Maybe we're just dehydrated as well. So that's something that we also need to pay attention to. So dehydration can wreak havoc on the body, and it can make you feel like you're having a flare up, when in reality, your body's just really thirsty. On the other hand, optimal hydration looks like quick reaction times, clear thinking, control over your emotions and responses, greater concentration and productivity, and an abundance of energy, right? So wouldn't we all love to have that? So some of the ways that you can increase your water intake is by drinking structured or consuming structured water. Now, structured water is a combination of water, electrolytes, trace minerals, and fiber. Okay, so structured water you can find in fruits and vegetables, but you can also make it at home. So I'm going to share this recipe with you all. Structured water to make at home, you need about 10 to 12 ounces of warm water, a teaspoon to a tablespoon of fresh squeezed lemon juice, a pinch of sea salt, a teaspoon of chia seeds, and then herbs, some fresh herbs if you want to add that as well. So again, I'm going to stop sharing. I'm actually going to demonstrate this for you all. I have here a little setup for you all. So I have some water, some chia seeds, lemon, and sea salt to demonstrate how to do this. So I actually drink structured water every morning. I call it morning water because it's the first thing that I drink when I wake up. And I just like starting my day with this. So what I'm gonna do first is just take little wedge of lemon and just squeeze that into my water. So typically you either want like warm water or like room temperature, but try to stay away from cold water. All right, so I have a little bit of lemon in there. And then you want a pinch of sea salt. Now I have a grinder here, so I'm gonna kind of just estimate what a pinch would be. And you definitely want to make sure it is sea salt. So I have pink Himalayan sea salt, but there's also like the clear sea salt, which is different from table salt. So you do want to make sure that that is specifically sea salt. And then I'm gonna add just a teaspoon of, just a half teaspoon of chia seeds. Now the chia seeds are optional if you don't like chia seeds in the water just because of the texture. That's perfectly fine. Definitely do the sea salt and lemon, and then try to get some extra fiber in through the rest of your day. So cheers to structured water. Okay, so that is a little note on hydration. So I realize I'm giving you all a lot of information, but just to recap, some of the practical steps that we have gone over so far are the lymphatic drainage techniques, the big six, and the head and neck, breathing techniques, and then hydration. So we've touched a bit on hydration as well. And so the last thing that I want to go over with you all is some movement. And for movement, let me share my screen again. Okay, so for movement, I apologize, my computer is not presenting. Here we go. Okay. We all know that movement is really important, right? We've spent some time loosening up the lymphatic fluid. We've applied manual pressure to do all that. We've focused on breathing, and we have also hydrated the body. So now it's time that we move all of those things. And so I laid it all out in this specific order because when I or my clients experience an acute flare up, like this order really helps. You first want to stimulate the lymphatic system. You want to breathe, hydrate, and then you want to move all of that to where it needs to go to get the body moving and functioning and recovering well. So movement is medicine for creating change in a person's physical, emotional, and mental state. Okay, so we know that movement provides a lot of benefits for both the mind and the body, and even just 30 minutes of walking 3 times a week can reverse any kind of cognitive decline you might be experiencing. You want to think of exercise as kind of like this 401k for your brain, right? Every time that you move the body, you're experiencing long-term benefits. And of course, you will also experience more immediate benefits, but also think about just like the long-term impact that daily exercise can have, okay? And as I mentioned earlier, 2 things move fluid: movement and breathing. So we move that lymph fluid manually, but you can also move that lymph through exercise, through bodily movement. And the great thing about the lymphatic system is that the majority of your node clusters, so where a lot of those nodes are actually around your most mobile joints. So think like through your neck, through your shoulders, through your hips, behind the knees, like those areas that we addressed in the big 6, those are areas that are also very mobile. and areas where a lot of your big node clusters hang out. So I'm going to take us through a total body movement routine. It's going to be just short, less than 10 minutes. And if you have a chair and a stick, I will give you some time to go grab that. But this is going to be the kind of last portion of our presentation today. All right, so I will stop sharing. Okay. And I will get up again, and we are going to start with the head and the neck. So I want you to stand up, and then feel free to also do this seated. We're going to work our way from the top down. This is just a simple routine that you can do this every day if you'd like. It's kind of part of a warm-up, or have this be your movement session. Or if you are experiencing a flare-up, this is good to stimulate that lymphatic fluid as well. So I'm going to take your hands out by your side, and I want you to reach those fingertips down to the floor. And we are going to take your right ear to your right shoulder, and then sweep that chin all the way down and across your collarbones over to the other side and all the way around. Now we'll go one more. Very, very gently. Good, and we'll bring it back to center and relax those shoulders. And again, reach those fingertips down towards the ground. We're gonna go to the left. Sweep that chin down and across the collarbones. Over to the right and all the way around. And one more time, all the way around. Good, and bring it back to center and relax. All right, we are going to take arms out in front of us, and we're going to pull those shoulder blades back, up, reach forward, and down. We're gonna pull the shoulder blades back, up towards the ears, push forward, and then down. And again, push, pull back, pull up, forward, and down, and relax. So, a little movement through the shoulder blades always feels good. All right, we are going to focus a little bit more on the shoulders, and we're gonna do just one arm at a time. So I want you to take your right arm, and I want you to start to bring it up and across your body, and then up across the face, up towards your ear, and you are going to rotate. I'm going to drop down so you can see this. So you're going to rotate that palm out, and you're going to keep reaching behind you, finishing out that circle. And you're going to bring that arm by your side. Palm is facing out, and then we're going to go in a reverse direction. So we're going to reverse that arm, reach behind us, lift it as high as you can, and then rotate that palm up. Bring that arm up by the ear and down and across the body. Good. So we're going to do the other side. So we're going to take that left arm across the body. Start to lift that bicep up towards your face, up towards the ear. When we reach the top, we're going to rotate that palm out and then reach behind us as far as we can. Really stretching that arm. Bring the arm all the way down by your side. And then we're going to reverse. Lift. Rotate that palm up and finish out that circle, bringing it across. Keep reaching, bring it across the body and back. Okay? All right, roll the shoulders out and come on up. Next, we're going to focus on the spine. I want you to take your arms across your chest. So I'm just kind of placing my hands on my shoulders. Okay. From here, I'm going to roll my chin down, kind of start to tuck my elbows in, and I'm going to rotate to the right. So I'm kind of using this hand to push into my shoulder. Think about pressing that shoulder down into your back pocket. And we're going to come up, roll through the middle, and then over to the other side. So now this hand is pressing the shoulder into your back pocket. And we're going to finish out that circle, roll forward, and come back to center and back up. And we're going to go into the other direction. So tuck that chin, roll forward, press those elbows down, and we're going to rotate to the left, and then start to press that shoulder down. Good. And we're going to lift those elbows, coming over to the other side. Now this hand is pressing the shoulder down. Good. And we're going to rotate back to the middle and come up. Good. And we'll release those shoulders. All right. So if you have a stick with you, this is a good time to grab that. So we're going to do a little bit of hip rotation here, so a little hip movement. So you're going to start to pick up the right leg. My stick is in my left hand. You are going to take your foot to your stick here. And I want you to slide it up that stick. I'm pulling my knee up as far as it'll go. And then I'm going to rotate that foot out, and I'm going to open my hip up to the side, and I'm going to keep driving that foot to the back, trying to keep my knee as lifted as possible. Good. And then I'm going to bring my knee around and down. Then I'm going to go in reverse. I'm going to pick that foot up. I'm going to drive that knee back, and I'm going to bring my hip out, my knee out to the side. Good. And then bring that hip in, rotate that foot in, and then slide back down. Good. Okay. Now we're going to go to the other side. So I'm going to bring that foot across, and I'm going to slide it up, pulling my knee up as high as it'll go. I'm going to rotate out and open up that hip. Good. And I'm going to keep driving that heel back, keeping my knee as lifted as it'll go. And then I'm going to finish out that circle and come down. Good. And then I'm going to go in reverse. Pick up that foot, drive that knee up and out to the side. I'm going to open up that hip, bring my hip in, rotate that foot in and down and back to center. Good. All right, you can set that stick aside. And lastly, we are going to do the knee and the ankles. So you can either come down to the floor or you can actually do this in a chair. So I'm going to hug one knee in. Okay, I'm going to take my hands behind my knee, and I'm going to rotate my foot out, and I'm going to extend at my knee. I'm going to rotate my foot in and bring my knee down. And I'm going to extend, keep that foot in, and then rotate that foot out and bring my knee in. Good. And now we're going to go to the other side. So I'm going to hug behind my knee. I'm going to rotate that foot out. I'm going to extend my knee, rotate in, bring the knee down. Keep that foot rotated in and extend at the knee. Rotate the foot out and then bend at the knee. Good. And then we are going to finish out with some ankle circles. So I'm going to take one hand behind my knee and one on top of my knee. And I'm just going to do some ankle circles here. And then I will reverse the direction. Good. And we'll release and go to the other side. So take one hand behind my knee and one on top. And do some ankle circles. And with all of these movements, you can do as many reps as you need. I'm just showing you the quick version for time here, but you can do as many as you'd like on each of these. All right, and so that is a quick total body movement that you can do on a day that you are experiencing an acute flare-up to hopefully stimulate some lymphatic flow and to help you feel better. Okay, thank you so much for joining me for a few minutes of movement. Like I mentioned earlier, you can repeat the reps as many times as you like, as many times as feels good to you on a day where you wake up feeling like you're not feeling that great, so you want to move a little bit. So just to recap our presentation today, you wake up, you have a lupus flare, now what? What do you do? 1, address the lymphatics. 2, practice some breathing. 3, hydrate. And 4, move your body, okay? So all of these are very practical applications that you can use to manage an acute autoimmune flare-up. And even if you are not experiencing an autoimmune flare-up at the moment, you can use all of these practical applications to prevent autoimmune flare-ups in the future. So all of these are all part of my daily routine. For the most part, you know, we're not all perfect, but I try to implement all of these in some way every day. And that helps me to feel my best and have an improved quality of life. It has helped a lot of my clients do the same. And so I'm really excited to hear back from all of you around how, which of these did you implement? Which one did you like the most, and how they have benefited you? And so to wrap up, I want to share with you all about the Remade method. So this is my coaching program. It is a 3-month movement program that combines movement and mindset, emotional well-being. We go a little bit deeper into those lymphatics, into some nutrition and lifestyle changes. So in those 3 months, you get a one-on-one individual movement program for you to help you incorporate exercise as a way to manage your autoimmune disease, manage your lupus. And that is all delivered through a virtual training app called the Bridge app. So you can train on your own time in your own schedule. You don't have to worry about, meeting me at a certain time. And this is virtual, so you can literally do it from anywhere. So we don't have to necessarily be in the same place. And what's great about a virtual training program, a remote training program, is the fact that if you do wake up with a flare one day, you don't have to worry about rescheduling or paying any late cancellation or late fees like you would with a personal trainer at the gym. You can train on your own time, your own schedule. So it allows for a lot of flexibility so that you can work with your lupus and not have to force yourself to do things when you are not feeling well. And as a part of this 3-month program, we will meet on a bi-weekly basis. So every other week we have a one-on-one coaching session, which is your time. So we can discuss anything from mindset to your emotional well-being, dig a little bit deeper on lymphatics. We can discuss nutrition, or we could dig a little bit more into movement. So some of my clients really like to use this as a personal training session, a virtual personal training session. Some of my clients really like the conversation piece of it a little bit more. So really that is your time. This program has helped a lot of my clients significantly reduce flare-ups and help them implement better lifestyle practices that helps them work with their autoimmune disease instead of against their autoimmune disease, and has helped them significantly reduce inflammation, improve blood work levels, and things like that. So if you have any questions around the remade method, I would love to talk to you about this some more and see if this is something that you are ready to implement into your day. And I would be honored to coach you through the remade method and help you improve your quality of life with an autoimmune disease. And I hope that today you have seen that there are very practical things that you can do right at home that are inexpensive, that can help you live a healthier lifestyle with an autoimmune disease and help you take back control of your health and control the things that you can control, right? We are controlling the controllables here. And so I hope that this presentation has been beneficial to you. And it has been an honor to teach you all today. And it's been an honor to share with you some of the lifestyle practices that I implement in my day-to-day and that my clients implement in their day-to-day as well. So if you would love to stay connected, you can visit my website, remadewellness.com, and on there you can find a free download, 5 things to consider before exercising with lupus. So if you have any questions around implementing an exercise program with lupus, maybe you have some concerns, go to my website, remadewellness.com, download that free download for you. And if you have any questions, you can reach me at hello@remadewellness.com. Feel free to send me a message. Let me know if you have any questions or feedback about this presentation. Let me know what you took away and what you enjoyed. And I'm also very often on Instagram. You can find me at Daniela.Spear on Instagram. So if you are on Instagram, I'd love to connect with you on there as well. So thank you all so much for being a part of this presentation. And again, I hope that you were able to take some things away from our talk today. And I want to thank the Lupus Foundation of North Carolina for having me back again this year to speak with you all and to share my passion of living well with autoimmune disease with all of you. So again, if you have any questions, I'd love to hear from you all. Thank you again, everyone. And I hope you have a great rest of your Lupus Summit.